Welcome to the channel. I'm Work in Progress, and you're watching the DSM-5 Explained. In my video going over Reactive Attachment Disorder, I mentioned several potential treatment paths those suffering may find helpful, and today, I'd like to go over them in a little bit more detail. Before I go any further, as always, the video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Now, with that out of the way, the specific therapies I'd like to talk about are play therapy, art therapy, animal-assisted therapy, eye movement desensitization and reprocessing, or EMDR, trauma-focused cognitive behavioral therapy, and parent-child interaction therapy. In this video, I'll go into the topography, domains of effectiveness, and a brief history of each of the aforementioned modalities. I'm excited to be able to share each of these with you, as they have helped countless individuals in their journey for better mental health. Some of these modalities have a longer history than others, but each of them have been shown to be effective tools for people to have in their proverbial tool belt. Play therapy was originally created by Anna Freud in the 1920s, and then further developed by Margaret Lowenfield and Melanie Klein over the next 40 years. It was postulated that child's play could be thought of as a stand-in for adults' free association. Through allowing a child to have control over the themes, style, and speed of play, it could allow the child to work through traumatic experiences in a more organic way than other therapeutic modalities. Play therapy has emerged from elements of child psychotherapy, with the specific theoretical foundations emerging from the humanistic psychology tradition and attachment theory. In Britain, play therapy started to emerge as a new and differing tradition in the 1980s. Initially, the Child Hour Trust taught professionals that the basic techniques of axoline play therapy was used in a multitude of settings. In parallel, two drama therapists started using play therapy methods to inform their drama therapy practices with children. Sue Jennings in 1994 and Anna Katanich in 1993 integrated elements of non-directive play therapy to formulate a British play therapy movement. In the 1990s, the Institute for Drama Therapy started to offer a certificate and diploma in play therapy. Some potential benefits to play therapy are taking more responsibility for certain behaviors, developing coping strategies and creative problem-solving skills, self-respect, empathy and respect for others, alleviation of anxiety, learning to fully experience and express feelings, stronger social skills, stronger family relationships, and play therapy can also encourage the use of language and improve fine and gross motor skills. As touched on earlier, this type of therapy consists of allowing the child free rein of their assigned playtime under the guidance of a trained practitioner. Playing in a safe, controlled environment allows the child to explore parts of their personality and emotions which have, for whatever reason, atrophied or become underdeveloped. Art therapy can trace its roots to Europe in the mid-20th century, and its name to British artist Adrian Hill, circa 1942. In this time, sanatoriums were just as likely to house those suffering from tuberculosis as they were to house those with legitimate mental illness. In these overcrowded conditions, it was observed that the dissemination of artistic outlets correlated with lower instances of patient emotional distress. Slowly, thanks to Edward Adamson, an artist employed by the Nazarene Hospital, art therapy began to spread through mental hospitals. In 1964, the British Association of Art Therapists was established after the value of art therapy had been shown. In more recent years, researchers have explored the benefits of art therapy for treating a variety of physical health difficulties. Some of their findings show that art therapy helped reduce pain, decrease symptoms of stress, and improve quality of life in adult cancer patients, improved the ability to deal with pain and other frightening symptoms in children with cancer, reduced stress and anxiety in children with asthma, stimulated mental function in adults with dementia, and even indicated a reduction in depression in Parkinson's patients. The beauty of art therapy is that it can be as varied as the individuals practicing it. While other forms of therapy, such as EMDR, rely on a rigid structure to attempt to help the brain reprocess trauma, art therapy, on the other hand, allows the individual to express their unique stories and problems in ways that are tailor-made for them. On top of this, creativity expands to a wide range of mediums. The most common are painting, drawing, collaging, and sculpting. Related, but not typically included within the modality of art therapy, are music and creative writing. Animal-assisted therapy has a long and well-developed history. In the late 1800s, Florence Nightingale noticed that small animals helped reduce anxiety in both children and adults in psychiatric institutions. This led to her laying the foundations of AAT, or Animal-Assisted Therapy, a foundation which was later built upon in the 1930s by Freud, who believed that dogs had a special sense. He would use his own pet, Jaffe, to gauge a patient's degree of tension. His observations were that the higher the levels of tension, the closer to the patient the dog tended to stay. Freud's view on animals' therapeutic potential did not become apparent until almost 2 decades after his death, when a series of books were released that included translations of his letters and journals. The practice was further developed by Boris Levinson in 1960s. During his sessions with traumatized, non-verbal children, it was discovered that the child was able to communicate when Levinson's dog joined him. It wasn't until the late 1980s that the Delta Society, now Pet Partners, developed a certification program to ensure that animals are proficient at providing AAT. Over the years, AAT has been reported to be particularly effective in improving social and communication skills, easing anxiety, improving mood, facilitating independent living, improving empathetic skills, improving energy levels, self-esteem, and decreasing depression, as well as increased motor skills and movement and verbal communication. On top of this, AAT has been shown to have tremendous physiological benefits. In 1995, a sub-study of the cardiac arrhythmia suppression trial that included 369 participants who all had myocardial infarctions found that those who owned dogs had significantly increased survival rate at 1 year, with mortality being 4.05 times greater for those who did not own a dog, with a p-value that is less than 0.05. During a canine-assisted therapy session, a trained handler will bring the therapy dog to the patient and allow the patient to interact with it. Therapists will usually provide handlers with instructions and guidance to ensure that patient interactions with the therapy dogs are always in ways that help the patient benefit and achieve their goals. And that's where I'll call it for today. Join me next time when we go over the other treatment modalities in this list. Hey y'all, I named this channel what I did for good reason. I wanted a constant reminder that as accomplished as one may feel, we are all just works in progress. I am no different than anyone else in this sense, and I need your help to grow and learn. I put my heart into each one of these videos, and I have a great time doing it. However, in order to make these videos the best they can be for you, the viewing audience, I'm asking for your feedback. What you like, I'll keep. And what isn't received as well, I'll do my best to correct. We're in this together, and if your comments are particularly poignant, I may even feature them at the end of a video. Wherever you are in your journey, just remember, each and every one of us are simply works in progress. See you next time.